right, we're going to go out to Big Budah right now. He's in South Jordan to have a little bit of fun with a dentist. Is that an oxymoron? Can you have fun with a dentist?
Is there happy gas?
I guess that's the key.
Dan, I don't want to say anything that's going to probably upset any potential dentists that might be working on my teeth this morning. So I'm going to just say, yeah.
You keep it cool.
Yes,
yeah,
you're right, Dan.
Plenty of fun with a dentist.
It's not an oxymoron. Now, I will tell you something. Pulling a tooth is a lot easier than pulling a submarine out of a pond. That I know for sure. So,
are you going to let him pull one of yours?
Maybe if there's something wrong, but if you know what, if a doctor recommends that it should be extracted, then I'm probably going to have to agree with a professional.
Well, if it's as yellow as the submarine, it should probably come out.
If it's yellow like the submarine, you got more serious problems.
Yeah, you got some trench mouth going on.
Getting your tooth extracted. Yeah. Let's meet Dr. William Carroll. Good morning, sir. How you doing?
Good to meet you.
So, do me a favor. Talk about. I've driven by this building many times, and I have seen the sign, Roseman University, Health of Sciences, Sciences of Health. If you can you break it down? What is this university about?
Well, this is a normal nonprofit educational university. We have 3 schools, colleges, a college of nursing, college of dental medicine, and college of pharmacy. The university was founded in Southern Nevada in 1999, and they moved up here in 2005. The campus opened with the College of Pharmacy and then the College of Nursing. And we've been here since 2011 with our first class.
Is it designed for individuals? What kind of individuals in mind was the school designed for?
That's a good question. We're here for the underserved. We're here for those who maybe haven't gone to the dentist in a while and have a lot of dental work and need it done. And as you know, the cost of dental care is expensive. Getting that tooth you just talked about extracted or pulled is very expensive.
Now, although our focus will be on the dental clinic and the careers that people are gearing up for in the dentist. The dental industry, what are some other careers that maybe somebody at home say, you know what, I've been looking for something new, something different in my life. What other careers do you guys offer here?
Well, we offer a PharmD program. You know, a lot of hospitals and you go to the supermarket, drugstores, when you pick up your medications, usually it's a pharmacist that prescribes or gives them to you. We also have a nursing program. There's a tremendous need for nurses throughout the United States, especially with the increase in health care, the Obamacare so-called programs that are coming online. A lot of nurses, that's a great career opportunity. And we offer a Bachelor of Science in Nursing. So PharmD, Bachelor of Science, and of course our DMD program. So.
All right. So the program's been, the dentist program, Dan and Carrie, has been here at least 2 years, but it's the first time they're opening their doors to the public. Just how they're doing that, we're going to break it down for you this morning. We'll talk about services. I mean, look at this place. It is stacked to the T, man. All right? Why are they stacked to the T?
Filled to the teeth?
Carrie, I got an appointment for you so you can pull out that yellow tooth you've been talking about.
Thank you. As long as there's happy gas.
That's funny. You made her an appointment. I brought my
it's gold. Sorry, John just corrected me. It's gold. Sorry, you got that gold teeth and you're in a rap video.
That's my grill, or whatever those are.
He's got one grill.
We'll be back. I promise you we're going to show you how fun dentistry can be here at Roseman University. All right?
Thanks,
see you guys.
B. We're going to go out to Big Budah right now, who's in South Jordan. You know that Big Budah recently had surgery as he's losing weight and doing a great job. And one step to further the process along, he's going to have all of his teeth pulled as well. So,
how much weight will you lose that way?
I was wondering where you were going with that, Dan. My teeth don't weigh that much. It's not going to help me in my weight loss program.
No, that's to help you.
It's all hollow inside.
You can't eat as much.
Gum the food.
No, that's why I'm here. I'm trying to find out. We're talking with Dr. Alder right now, and now I know the college has been here for 2 years, or the program, but this is the first time that services are being open to the public. Is that correct? And what are we talking about?
That's right. The students are seeing patients now. Any procedure that you can get done in private practice or in a corporate dental practice can be done by the students. The students, while they're working, they're being overseen or supervised by a licensed dentist.
Couldn't bite now.
And so, as they go through the steps, you can be sure that you're getting good quality care.
No, are these advanced students? I mean, obviously, I'm sure they're not like right out the bat, you know, like an entrance exam. Before we accept you, let's have you work on a patient. I'm sure it's not like that, right? I mean, we're talking about like students getting ready to graduate and move on to their careers.
Right. I mean, they're going to graduate in not too long down the road. They've been through classes. They've been here for a couple of years now. They practice on each other, and now they start with screening patients and they move on to comprehensive exams, and then as they progress, they pretty much do everything that you can get done.
Now, are the services offered at a discounted rate, or is it the same thing as going to a regular dentist?
The fees are discounted, anywhere from 25 to 50%.
Wow.
Yeah,
That's
so
really good.
It is good. There's some trade-offs for having treatment done at a dental school. Usually the appointments take a little bit longer, just because they're being supervised by a dentist.
But they're being done right. That's all everybody needs to know. Right?
That's right.
Okay.
That's right.
I appreciate Dr. Alder. Danny here is a student at the program. Sorry to interrupt your procedure there, Danny, but so what's it like for you to being a student now? How long you got left in the program?
Well, I've been in there 2 years, a little bit over 2 years.
This is probably not your normal way of doing stuff with a patient, having a camera and
No.
neither one of us sterilized. That's probably not how you like to do things, huh?
Nope.
We're sorry, Dr. Pan. But I do have one question. I noticed that you do have plastic here. Is this because the equipment is so new?
No, this is infection control. We need to make sure that everything's under control and that we don't have any problems with infections. So.
And would you recommend the program to anybody out there looking for a new career, doing something else besides what they've been doing for the last couple of years?
Absolutely, that's my story. I was in Utah for 10 years working in a law firm, and I decided to change. So, perfect example.
All right, so we're going to step out of the way because Danny's working on Dr. Penn right now, but we're going to give you a live teeth cleaning, or maybe it's a tooth cleaning, because I think Carrie's sister is here and she has a golden tooth too, so we're going to clean that too.
They got matching golden teeth.
That's how we know we're family.
Well, it just sticks out. It's more of a snaggle tooth, but whatever. I mean, that's just a family trait that Carrie has.
Snaggle tooth, huh?
We're going to do a live teeth cleaning coming up next, I promise. See you guys in a little bit.
Thanks, B.
We're meat eaters.
We put cameras in the dentist's office this morning to just see what happens.
Why not?
Big Budah's out there in South Jordan. He's having a little bit of fun with the dentist, or is the dentist having fun with you?
Well, we're trying to have some fun, and we're also trying to educate the public. Dentist costs are, their costs. I mean, you got 8 kids, everything's, it's a bill. So what I love about Roseman University is that they're offering these services that you can get at any dentistry place, but at a discounted rate. Now, we do have a live cleaning going on. Again, this doesn't normally happen. They're allowing us to bring the cameras in and see what's going on. We're talking with Dr. Richards. This is the first thing that a dentistry student learns here at Roseman University, but everything's supervised, like we talked about already.
Absolutely. We're constantly supervised. They work under our license. This is the first thing that we want them to do with the patient because it's a more simplified thing, and also we give them an opportunity to educate the patient. Part of their education is to start teaching the patient how to take care of themselves.
No, that's the most important thing. So what are we talking about?
Basically, we teach them how to brush their teeth, how to floss, because a lot of people don't know how to do it. They do it inefficiently, so we want to teach them how to do it efficiently. We want them to be able to fish instead of just giving them a fish. That's my example.
I like that. I like that. Now I'm surprised that there's still people out there that you have to educate on how to brush it. Brush their teeth.
Most everybody think they're doing a really good job, but they're not. They just don't know the techniques that need to do in order to do a more efficient job, and so it's important that we teach them how to do that. That's surprising the changes that will make in people's lives, just being able to clean their teeth better, and also teaching parents to start teaching their children properly.
Right.
Yeah. So it's
flossing is still important.
Flossing is very important. It's the only way we get in between the teeth. Unfortunately, it's the hardest personal hygiene thing we do.
I should believe Dan. Dan tells me that all the time, but now that I've heard it from a doctor, I'm going to believe it. Sorry, Dan. Now, last question, because we're out of time. How often should one go get their teeth cleaned?
Generally, a person who's seeing the dentist on a regular basis, about every 6 months. Some of these patients that come in haven't been in for years, so we have them come more frequently.
All right. We're going to head downstairs when we come back and check out the new technology, the new hotness. What kind of advancements do they have in dentistry? We're going to find out together. Coming up. See, look,
big bore drill,
that's a model patient, right? Maybe a big drill, Dan. I don't know.
All right, we're going to find out. Thanks, B.
We'll see you guys in a little bit. Bye.
Okay, I don't know if going to the dentist is normally what one would consider fun, but
I actually
today it
don't
has
mind
been.
it.
It depends how much laughing gas you get.
Exactly.
Yeah, I've never had any real dental work done, so I think it'd be I always have fun there, you know?
I think he's trying to say, yeah, he hasn't had any cavities.
It's just
Ever.
easy. Well, why are you guys mocking me just because I have never had any cavities? But yeah, I mean, all they do is clean them. Feels good. Tickles a little bit. What's up, B?
We're doing a little bit of the old and a little bit of the new. I already know the answer to this question, but I want to ask Allison. Allison, growing up, did you have a song that was taught to you in elementary school or junior high on how to brush your teeth?
Brush them, brush them, brush them.
There you go.
That was a commercial maybe, wasn't
Brush
it?
them every night.
I don't know if that is that.
That explains a lot.
I don't know if that's how the lyrics go.
Yeah. Dan, remember growing up, I'm sure you remember this song, Up and Down, Round and Round, that's the way you brush your teeth. Right? Remember that song?
No, but I do remember the brush your brush.
That also explains a lot. That also explains a lot. That's
I never had to brush my teeth.
Dr. Powell, good morning. How you doing?
Good morning. I'm doing great. How are you?
As I said, we're doing some old and we're doing some new stuff. Back in the day when you were going to school, what were some kind of props or some kind of the equipment that you used to kind of learn the art of dentistry?
In our laboratories that we used in the pre-clinic, we had just a metal rod that wore a chrome helmet, and our artificial teeth are the type that fit down on the rod. You tighten down a clamp and you lean them back. The helmet simulated a head, and we worked on the teeth. Used air to blow it off. We did not use water in there because we didn't have suction. So it was basic, but like me, kind of old technology.
No, you're not old technology. Has stuff changed for students these days? What are they working on?
They use a simulator now that really simulates an actual patient. You'll watch here as he gets this unfolded. We have the patient has a chest. It simulates a dental unit, and the teeth come with lips, cheeks. It snaps in magnetically.
And those are some perfect teeth. How do they do any work on that? Those are really good looking teeth.
Oh, we can tear those teeth up real nicely. Actually, they practice on doing the ideal tooth preparations for restoring decay, or teeth that have decay, and they can do the preparations for fillings, for crowns. We have models that don't have teeth, so they can learn how to make dentures.
Okay.
And they
make things a lot easier for the students.
Well, yes, and it makes things really easy for the patients, because if they're going to accidentally butcher a tooth, it's not attached to a real person.
Okay.
And they're replaceable.
We're going to come back and we're actually going to do some work on our models here. But if you notice, can you close this mouth in? Dan, I did not know you were the model for look at this. Look at how flappy your lips are. Look at that. That is Dan Zevin.
All the time.
Shut your mouth, Dan.
Yeah.
That is crazy. Look at that. Look at how flexible your cheek is, Dan. That's crazy.
Yeah.
All right.
That's what you get from flapping your gums all the time.
We're going to come back to those stations back there, and we're going to do something really fun. I promise you. All right? Dr. Powell, thanks a lot.
Thank you.
All right.
Okay, well, Big Budah hanging out at South Jordan. He's having some fun with the dentist. You know, if that's what you want to do on your spring break,
go to the dentist. I can think of better things.
Reach for the sky.
Uh-oh.
Sorry.
He's got his blue gloves on.
And his mask.
I never reach when there are blue gloves on.
You know this. You know this sound. Yeah, you do. All right.
Yeah.
This is Sierra. We're back with Dr. Powell. So, Dr. Powell, talk about what we're about to do.
Okay, we set up a little exercise just for you. Normally, we cut cavity preparations in teeth, but we've placed the letters B on the face of the two front teeth. Sierra's going to take her handpiece and she's going to follow the lines and drill out the letter B, and then you're going to get to do it on the other tooth, so you'll leave with a pair of BB or Big Budah front teeth.
Now, this is not like a fad, right? Like, you're not going to fill what you just drilled with like gold or platinum, because I could see a lot of rappers doing this.
Well, this was going to be actually a model for your new grill.
Bling bling.
And bling bling.
Sierra, how long have you been doing this?
Just a year.
Just a year?
Yeah.
Seriously?
You'll be great.
Okay. Is it kind of like Operation?
Kind of.
The game?
Yeah.
Okay.
Remember to get the finger rest.
Okay.
Keep your hands steady.
Okay. Remember, I am not a professional. Oh, sorry. It's a lot harder than it looks. Sorry. All right.
I can let Sierra grade you on this if you like.
All right. What would you give me on a grade, Sierra?
I think you might need to try one more time.
Wait. There's a cavity. See it? That's a cavity. Let me. Oh, Dan Evans.
You're breaking the teeth off.
Hold on.
And you've got your.
There we go.
Ouch.
Now you can whistle, Dan. Okay.
I can whistle? And you had your finger up the guy's nose the whole time.
No,
that's comfortable.
no, he's fine. He's fine.
He's fine.
Yeah.
All right. It's a lot harder than it looks. That's why you have to go through school here at Roseman University, and then you can become like Sierra. Her last name is not Miss, Dan. It's not Miss. No. But she is from Levan.
We're learning a lot about Sierra.
Right by.
Yeah, right by. Yes. Nephi. Not first Nephi or second Nephi, just Nephi. just Nephi. Yeah.
Have you been sipping on the happy gas?
Something tells me, yeah.
Right back.
I think the laughing gas is on. It's just crazy. Does it sound like I'm yelling?
He's
Holy
very near the
smokes.
nitrous.
It's crazy out here.
Yeah,
No, it's not on. That's just me. It's all
never drill
natural.
on the happy gas.
Yeah. It's a lot harder than it looks, so give these guys a round of applause. They know exactly what they're doing. These are our future professionals. We'll be back. See you guys in a little bit.
All right. See you, B. Well, maybe he's like the secret weapon, you know. When he damages enough teeth, you have to just spend a little bit more money and get your bridge done, you know. All that work. I think that's what he's doing. Maybe not. A lot of people have kind of a partnership with their dentist. You know, you go in every 6 months or a year. Hopefully 6 months is what the dentist likes. We're going to go out to Big Budah right now and find out why he is there today. What's going on out there, B?
Not because of my dentistry skills. So I was
Well, that's clear.
It's a lot harder than it looks. But right now we're taking a tour of the classroom, and before we even get to that stuff that we did earlier, Dan, you have to learn about it here in a classroom setting. Dr. Jenta, how you doing? Good morning.
Good morning. Nice to meet you.
When I was talking to Dr. Powell, he didn't say any of this stuff back in the day when he was a student. This is pretty cool stuff.
This is so new. The way that we have our concept is everything is about technology and group learning. So what we have here are 6 monitors, and each monitor is designed to handle a group of students. And that group of students actually work together not only for assessments and exams, but they work together in the classroom, and they also work together in the breakout rooms, which are the doors attached to the lecture hall.
That sounds a little different. I mean, I was in college. I remember going to the class and having lectures, breakout rooms, doing a lecture.
Absolutely. So what we do is we work in blocks, and that allows us to tailor the material for what we need versus just trying to fill in a lecture time. So for example, if we have a half hour of material in the lecture hall, we do a half hour of lecture, and then we take that material and we do group activities in these breakout rooms. And what they do is they get to work on material both hands-on and lecture style.
While it's still fresh in their mind, it seems like, right?
Right. And because we do them in blocks, we'll take a subject and we'll have it working for about, let's say, a month or so, and they'll concentrate the material on absolutely everything that they need. But it's not just an hour of lecture in a big lecture hall where they have 1,000 seats. It's concentrated learning where every student is only 4 rows away from the instructor.
Do you find that the students are learning faster, learning better?
Yes, it's wonderful. It's not only faster and better, but it's concentrated so that when they're here, they learn only what they need to learn and not a bunch of fluff to fill in a lecture time.
Great technology. That means great students, great minds, and great service for you as a consumer when they go out to the field. So we're going to come back. We're going to head back and do some more practical. We're going to do something called a mold, not the bad kind, Dan. Like it's a good kind,
not
right?
Toxic mold.
All right,
not
we'll be
toxic
back.
mold.
Nice job, Doc. Thank you.
And of course, she has great teeth. I guess it's a prerequisite.
Sorry, mine died out.
Say ah.
What are you going to do? You just stick your finger all the way down there? You pull the trigger on me or something like that?
Got nails. That would work, I guess, for dentistry. Do it yourself. This might be a better option.
Do it yourself with your fingernails? Yeah, this is a much better option. Not to have Big Budah do the work, though. We saw that. He's breaking teeth out there, B.
Hey, Dan, I can hear the theme music. So does that make me Mr. Roper, or are you, and then you're Jack?
I guess
Which one do you want to be?
I'd rather be Mr. Roper.
Really? No,
Jack's cool because he's, well, I don't want to say. Jack's cool.
Yeah,
I'll be Jack. What's that?
We're just having some fun. Welcome back. We're live from Roseman University. This is Jen. Now, Jen, how long have you been in the program here?
Almost 2 years.
2 years. All right. And what are we gonna do today? What are we demoing?
So we're gonna make a mold, and in dentistry we call it taking an impression.
Okay.
And the first thing I'm gonna have you do, I'm gonna have you mix this up.
Okay.
I'm gonna add the water.
What am I mixing up?
You're mixing what's called alginate.
Okay. Now, what's the purpose? What purpose does a mold serve?
There's several things. We take them for casts, we can take them for bleaching trays, we take them for orthodontics. You got to be really vigorous.
Rigorous, okay.
No being a wanny there.
No, a wanny. I've never heard that,
That's right.
that statement. It must be a Utah statement.
It's
A wanny. Don't be a wanny.
Yeah, that's right.
Now, I got to ask you this. You know, I've seen a lot of women in dentistry. Is that the typical? Is that the norm? Or are there not a lot of women in dentistry?
You know, in Utah, it's not really the norm. Other places it is. So we're
like, what's a typical conversation? Somebody asks you, hey, are you going to school? Where are you going to school? Tell me a little bit a typical conversation that would happen.
Typical is, what are you going to school for? I'm going to dental school. And they'll say, oh, hygiene, and say no, and then they'll go down to assisting and say no. And it's dentists, and they're really surprised.
They don't go up.
They don't go up.
They go up. They think they start somewhere and they keep going down.
Yeah.
Secretary, you're just secretary.
But you know, it's okay. It's something that's new.
So how important is it for you to make sure that you complete and maybe set an example for maybe some of your female siblings?
You know, it is really important. It's important to, I think, for any woman to do what they really want to do, whether it's be a doctor, go to dental school, or even if they want to be a stay-at-home mom, do what they want to do.
Or a wanny. If you want to be a wanny. I've never heard that before.
It's an Idaho thing.
All right, so it's an Idaho thing, not a Utah. Okay, so now what are you doing?
Okay, so now we're going to press this down, and this would be like a normal lip.
Uh-huh. That's a Dan Evans lip right there. See how flexible that is?
You're going to cover the lip, and then you're going to hold it there.
Okay, I'll hold it.
All right, go ahead.
All right, how long do I hold it here?
So usually it's about 2 minutes, and then it's until this becomes really firm.
All right. So really quick, I want you to look into the camera and tell the little girls out there that want to grow up and be dentists that they can do it too. Give them some advice.
You can be a dentist. You know, honestly, if it's really something you want to do, go do it. You can do it.
Yeah. Dreams can come true, except for yours, Dan. Well, you're not a little girl. That's all right. We're going to come back, we'll wrap things up, and we'll show you the finished mold. You just act like a little girl. That's what I've heard. That's what. You stop acting like a wanny. Stop being a wanny.
I know.
We'll be back. Nice job.
It's great to see their enthusiasm for it. You know, you don't get that enthusiastic when you go to the dentist.
I know.
You know, when you've got your appointment, you think, oh,
I kind of dread it. Big Budah hanging out in South Jordan, but he's showing us you really can have fun at the dentist.
Let's see it.
Dan, you're going to the wrong dentist. You've got to come here because
like
you do
mine.
get excited.
Yeah.
You do?
Yeah. He's a great
You might
guy.
want to get your money back, bro. I've been up close to you. You might want to get your money back.
Yeah, it's because he never
really
does
quick.
anything.
Everybody at home has got kind of like a preview, just a little taste of what Roseman University is all about, especially their dental program. Dr. Chen, anybody that's watching, who would this be perfect for? A candidate for this program, if they're looking for a career path or anything like that?
Sure. I think that anyone who's interested in the health sciences and folks who are, enjoy working with people and having an opportunity to make a huge impact would be folks that should be looking at dentistry.
All right. So now the obvious question is, Dr. Pan, so how do I get started? I definitely want a career. I definitely want to make an impact. How do I get started?
Well, that's a wonderful question. Let me just say thank you for coming today, because this has been a great example as you've met our staff and our students and our faculty in the programs. The way you get started is you've got to be excited about the health professions, because that's what Roseman does and does very well. So we focus on dentistry, pharmacy, and nursing, and then we have some numbers that we can give you as well if you'd like to hear about the education program if you want to be a student, and number two, if you want to be a patient, we can give that number to you as well.
Okay.
Is that ready for you?
Yeah.
For you? Yeah. For students, it would be 801-302-2600, 801-302-2600. And for patients, it would be 801-878-1200 or 801-878-1200.
Now, patients meaning you come in and get some dentistry work done at a discounted price, correct?
That is correct.
Okay. For more information, can we go onto your website, to kind of learn about it before we actually come in?
You certainly can. rosemandental.com. You can certainly do it that way. Or go to roseman.edu, and you can find out about the educational programs here.
Right. Well, Dr. Ben, thank you so much.
Thank you.
Dr. Chen, thank you so much as well. All right, guys, that's all the time we got. We're going to send it back to you. You know, with the spring come new baby animals. So for Live at 11, we're going to head up to This Is the Place Heritage Park and check out the new crop of baby animals. All right? Dan?
B?
I'll see you and your hair at Live at 11.
And his perfect teeth.
I'm going to try to bring my hair. Thanks, B.
All right, buddy. We'll see you.
See ya.